I think we can admit everyone, or I think everybody is here already. Okay. So good morning, everyone, and welcome to this CME organized by United Eastern Medical Services, a Mubadala Health partner with Health Plus Clinics, Moorfields Eye Hospital, Abu Dhabi, and Danat Al Emirat Hospital. Today, we are extremely pleased to have Dr. Fateh Al-Khatib with us, and he will be talking about thyroid nodules with an update on the diagnosis and management. Before I introduce you all to Dr. Khatib, I just want to tell you about the ground rules for this presentation. So as always, it's an online presentation, so I would request all of you to be on mute. And if you have any questions, you can keep posting them in the chat box, and Dr. Khatib will be more than happy to answer them at the end of his presentation. There will be a link posted in the chat box, and this is a link for your pre-lecture assessment. This is just a quick survey, less than a minute, to check basic knowledge about the topic, and also important for us for a certification from DOH. So please kindly go take a minute and complete the pre-lecture assessment. This, as well as the post-lecture assessment and the evaluation form that will be posted at the end, will be necessary for you to be able to get your certificate as well. So please watch out for these links in the chat box, and Anit has already started posting them. So please go ahead and complete that while we are waiting for Dr. Khatib to start. So with that, I'd like to introduce you to Dr. Fateh Al-Khatib. He is our endocrinology consultant at the Health Plus Diabetes and Endocrinology Center, and he has many years of experience both in the UAE, USA, and Jordan. And he earned his medical degree from Damascus University, Syria, and then went on to do his residency in internal medicine at Drexel University, USA, and also did his fellowship in endocrinology at Wayne State University, USA. Since then, he has more than 30 years of experience in thyroid nodules, underactive thyroid gland, obesity, and diabetes, and also enjoys teaching and has a lot of teaching experience. So I am going to ask Dr. Khatib to take over now and talk us through thyroid nodules and update us on diagnosis and management. Dr. Khatib.
Thank you, Dr. Neha, for the introduction. It's always my pleasure and my honor to work with you, Dr. Neha. And thank you for Mubadala and Health Plus for giving me the opportunity to present my lecture today for the audience. I would like to say good morning to my audience, and I thank them for coming and joining me in my presentation. I will take you in a 45 minutes journey to discuss an update on thyroid nodules, diagnosis, and management. During the presentation, my objectives are talk about the prevalence of thyroid nodules and raise awareness about overdiagnosis of thyroid cancers and the proper utilization of thyroid ultrasound. Then after that, I will go and give you a short presentation about the approach to thyroid nodule management in 2022 and focus about the new updated ultrasound imaging scoring system and the cytopathology scoring system. And I will finalize my presentation by talking about what the future is holding for this field of medicine. We'll start with the first part, the prevalence of thyroid nodules and how that led to overdiagnosis of thyroid cancer. Let's start by the definition of thyroid nodules. The thyroid nodules, or a thyroid nodule, is a discrete lesion within the thyroid gland that is radiologically distinct from the surrounding thyroid tissue. The thyroid nodules may come as a solid mass, a cystic mass, or a mixed cystic solid mass. The importance of thyroid nodules stems from either the concern of cancer, and this is the main concern for any clinician when he or she encounters a thyroid nodule. Then the size. The larger the thyroid nodule, the more likely they will start to compress the esophagus or the trachea, causing dysphagia and difficulty in breathing, respectively. This is true for a really large nodule, usually in the size of 3 to 4 centimeters at least. And the third importance for thyroid nodules is the function. Some of these thyroid nodules are hot nodules, overproducing hormone, and they are leading to thyrotoxicosis. The main and difficult aspect is assessing the cancer risk for these thyroid nodules. The size and the function are delivered to the clinician from the ultrasound measurements of the thyroid nodules and the function through the blood test. But always the clinician concerns is the risk of thyroid cancer. The thyroid nodules are very common. So before the era of ultrasound utilization, by physical exam, the physical exam can detect up to 5% of people have thyroid nodules in women and 1% in men. By ultrasound machines, the prevalence of thyroid nodule is 50%. This ushers a new era where we are flooded by many patients who have thyroid nodules, and our task as clinicians is to determine which one is cancerous and which one is benign. The good thing about thyroid nodules is that most of them are benign. So 95% of thyroid nodules are benign, and only 5% of these thyroid nodules are cancerous. If we look at the type of thyroid cancer we have, we will find 80% are papillary thyroid cancer and 10% follicular thyroid cancer. Both are considered differentiated thyroid cancer with excellent prognosis and high curability rate up to 98%. The medullary thyroid cancer, which represent only 4% of all the thyroid cancers, have intermediate prognosis, and the others, mainly undifferentiated thyroid cancer and lymphoma, have a higher risk and poorer prognosis. But again, 90% of thyroid cancers are amenable for treatment, and many of them can go in remission and full cure. Incidence of thyroid cancer for 2022, and it showed the thyroid cancer rank at number 13. But if we look to the other second table here, we will see the risk of somebody dying from thyroid cancer is very low. And this rank at 23 out of all the available cancers in the United States. So with that said, the risk of death from thyroid cancer in the United States is 0.000007, 7 in a million. Which gives you an idea that thyroid cancer are indolent, amenable for treatment, and most patients survive thyroid cancer. Autopsy found to have thyroid cancer to 10%. 10% of people will live of thyroid ultrasound, which led